I'm Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy to be here at our town hall moderating on Thursday, March 10th. We've got a packed agenda today, so a little housekeeping off the top. We will have a series of presentations and the chance for people to send their questions to the HHS News at hhsc.ca inbox. We'll have that prompt up a little bit later, but as you hear our presenters, think about questions you might have, and if you email them to that address, you will get an answer from one of the content experts today or someone else very quickly. At the same time, please consider celebrations that you might have. As is our custom, we'll end today's town hall with a moment of celebration, and it's your chance to give a shout out to a team, a colleague, a service, to something that's happened in the organization that's worth remarking upon. So keep those in mind as we go. And that's it from me for housekeeping. So without further ado, I'll ask our President and CEO, Rob McIsaac, to kick things off. Rob, over to you.
Thanks very much, Aaron, and good morning, everybody. Thanks for joining, as always. As we begin, I'd like to acknowledge that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. We'll continue today with a few acknowledgements. The first being that International Women's Day was just observed on March the 8th. Of course, HHS has a lot of work underway to improve the culture of equity, diversity, and inclusion across our hospitals. Gender equity is an especially important theme within this work, given the predominance of women in our workforce. It's work in progress, and you're going to hear more about it in the coming weeks and months. But in the meantime, I want you to know that our organization places a very high value on our female staff, physicians, and leaders. Their contributions to the local, global, regional, national, medical, and health community are critically important, to say the very least. Also this week is the National Day of Observance for COVID-19. That's happening on March the 11th. There's no doubt the last 2 years have placed an incredible burden on the healthcare community and on our society as a whole. Of course, I think we'd be remiss not to take a moment to recognize the incredible achievements born out of this challenging time, from increased collaboration and connectedness between all of us to the rapid emergence of virtual care. There are lots of important achievements that we need to secure going forward. Senior leadership has explicitly set goals around making sure this will happen. So tomorrow, flags across all our sites will be lowered in recognition of the day and of the heavy toll the past 2+ years has taken. But I think it's also important to recognize that gesture also pays tribute to each of you who have been part of this collective effort to serve our community and our province in unparalleled and difficult times. I also want to take a moment to acknowledge the current horrible situation that's unfolding in Ukraine. I expect our community will ultimately receive a number of refugees who have fled from that war-torn country. I also expect that many of these individuals will need medical care, and we know there's a higher proportion of women and children among those who are fleeing. As always, our hospitals will stand ready to respond to the health needs of those arriving in Canada in search of safety and support. We'll be remaining in touch with our community partners in the coming weeks to ensure we're prepared to support our community's response in whatever way we can. On behalf of the whole leadership team at HHS, I want to offer my thoughts and wishes to those of you and your families who have been impacted by these devastating events, whether it's because you have an emotional connection to the country, whether you have family or friends who are living there, or whether it's just heart-wrenching scenes that are coming out of Ukraine and that we're all seeing on a daily basis in the news. Having said all of that, I'm going to turn it over to Sharon Pearson, who is going to provide a detailed update on hospital operations and capacity. Sharon, over to you.
Great, thank you. Good morning, everyone, and happy to provide today's operational update. With respect to our COVID status, the numbers today, we are down to 40 COVID patients across our sites, with less than 5 now of those patients in ICU, and 1 outbreak, revealing that we're still a little bit susceptible during this period as we come out of this last wave. With respect to where we're at regarding occupancy, you can see our numbers there. We have seen a decline in our ICU occupancy, so pleased to see that. Across the sites, those pressures are still sustained though, despite we've seen the decline in the COVID volumes. We still have other pressures related to some of our outputs and our discharges. I'll talk about that in a minute, but you can certainly see from our small to large sites, we're having some pressures as high as 132% occupancy at the West Lincoln site. We have seen our ALC population decline a little bit, but there's quite a bit of variability. So typically we still remain within that 180 to 200 patients at any given time. If you can go to the next slide. While the occupancy is improving, we are less dependent on that unfunded capacity. So we are as high as 80 to 100 beds at one point to accommodate all of the volume pressures. We're down into about 40 to 50 beds now, which is still very challenging for the sites to manage, and we're working on reducing that number. The biggest challenge, of course, are health human resource pressures that we're feeling not only in hospitals, but across the sector. Many active recruitment strategies underway in partnership with our peers in HHR, but again, a very finite group of individuals that many sectors are vying for right now. We are seeing a great impact in our community, particularly in long-term care and home and community care, as they have experienced a significant decline in their workforce over the course of the last 2 years. So lots of attention in those areas as well. If we go to the next slide, we did receive the direction from the ministry in February that we could begin to ramp up our activity. So at this point, we're almost at 70% of our pre-COVID volumes, and that's in alignment with the provincial goal that exists presently. We have been adding additional blocks to the General, the Juravinski, and the McMaster sites, and other activity. We're trying to return the rehab population, the regional rehab center, and the regional or the rehab beds at the Juravinski. We do have a plan to repatriate the obstetrical program from Niagara back to West Lincoln for April, as well as opening up the 2 ORs that exist at the West Lincoln site, and then also increasing the activity across the heart investigation, arrhythmia, and endoscopy areas. As I've mentioned in previous town halls, our process is very thoughtful. It's very gradual, and it will take us time as we work through the challenges associated with the HR pressures. Other areas, we are increasing some of our ambulatory in-person visits really to support that procedural and surgical ramp up, as well as adding capacity to those clinic areas that can help us avoid admissions or impact early discharges. And of course, continuing to optimize virtual care and remote care wherever we can. We do have a planned reopening of the urgent care center starting the week of the 24th. There will be modified hours, but we will have a reopening of the UCC. And the next slide. And of course, deployment. Over the course of the last wave, we did deploy 312 staff across to various areas. At this point, 239 have returned, and over the course of the next couple of weeks, the remaining 73 will return to the sites. It is still essentially a coordinated process, and really we are trying to deploy back given our areas of priority and do some sequencing. I would like to add my very sincere thanks to all of those staff that were deployed. I know it was incredibly disruptive to your schedules and your lives. And we do sincerely appreciate that you would do that and support the work that we needed to do through the course of the pandemic. So many thanks for that, and many thanks for the receptions that the teams provided to these deployed staff. We heard great stories about how much support was given to your new members. So thanks very much for that, and I'll hand it back to Aaron.
Great, thanks very much for the update, Sharon. And next up on our agenda, we have Kirsten Krall, who's our VP of Quality and Performance and Chief Nursing Executive, who's here to give us an update on the evolving visitor guidelines, some announcements made this week. So Kirsten, over to you.
Yeah, thank you. And I'm also pleased, again, with our improving picture to let people know around our family presence guidelines. In our guidelines currently, we do have provision in there when we get into lower risk periods that we loosen these restrictions. And what you've seen at this point is that we are allowing 2 essential caregivers or visitors to come to the patient bedside per day. So we still have our visitor lists limited to 2 individuals, but our patients can change that list as they want. And it need not only be an essential caregiver or somebody right from their immediate family who might share their same household, which is what we've had up until now, but those visitors can be friends and acquaintences that are important in their lives. So really important that our patients have that presence, especially back in our inpatient setting. We're also allowing children back in, again, as long as they can wear their masks and are supervised by adults. So this has been really important, certainly for our children's hospital, but not isolated. Many areas where children are a really important part of family life and recovery. And then we obviously, with our vaccination, we will continue to encourage our visitors and our patients, of course, to get their vaccinations. We do not require evidence that people are vaccinated at this point in time. Again, given our low risk, not to say our policy will probably contemplate whether or not we would turn that requirement on down the road, but that's work that's in progress right now. And there are other changes that are coming up to that policy or that guideline over the next few days if we have some further consultation. Our subject matter expert team in the region has really given us some indication that we can ease these restrictions even further. So more to come, such as, these lists that we've had in present form for many months. Can we loosen that some more? Some further discussion around ambulatory areas, emerge, and even waiting rooms as things like social distancing perhaps can be eased up a bit. Anyway, so stay tuned, more to come on visitor presence, but this is great news. As we know, they're an important part of patients' recovery, wellness, whether in inpatient or ambulatory. All right, thanks very much, and back to you, Aaron.
Great, thanks very much, Kirsten. Okay, next up on our agenda, we have Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control. Dominic, so much scuttlebutt the last 24 hours with the province's recent announcements. What do we need to keep in mind in relation to the epidemiology?
I think the big question is what's ahead of us. I can show you what's behind us and where we currently sit. National view, just in terms of case numbers with all its limitations, quite stable over the last few weeks, I would say. Slow decline in most provinces, but again, we shouldn't draw too many conclusions from case numbers at this point of time. Next slide. When you're looking at the Ontario picture, again, that's my last slide that uses case numbers and just adding or having added some of the major policy decisions for the community added here. You can see how we peaked probably in the second week of January. So after we had those changes in testing, so we first had an artificial drop and then the true drop. Eventually, then we moved to modified stage 2 and modified stage and ended the modified stage 2 later, then allowed more capacity, dropped the vaccine mandates, and now for March 21st, and I just want to mention it here once, yes, mask mandates are being lifted in the community. It will not apply to healthcare as a high risk setting. Next slide. In terms of hospital admissions, similar picture, peak in January, since that's at the from a provincial perspective, an 80% reduction in patients hospitalized either with or due to COVID. So we are pretty much where we've been between the winter wave and the spring wave last year in terms of occupancy in general. We are much lower in terms of ICU, where we are in a similar range as we've been throughout the summer in the Delta wave there. Next slide. This is our local picture. Again, roughly 80% reduction since the peak. We've been lagging behind, if you remember, and then 3-4 weeks ago, we dropped faster than the provincial average and are sitting similarly as the rest of the province at this point. Again, similar to where we've been during the Delta wave or between the winter and spring wave last year, but ICU admissions much lower than either the Delta wave or after the winter wave last year. So that's the good news. Next slide. This is ICU admissions here at the provincial level, and you can see that that decline has slowed down now over this week. It's not going back up yet, but it looks like probably in that range of 200 to 250 we will probably stay for a while. The big question will it be increasing? How much it will increase? And this is a big black box at this point of time. The ventilated patients, which is the orange line, continues to decline at a relatively stable pace. So at least there we see that things continue to improve further. Next slide. Now the prediction for the future, and that's what everyone asks at this point, with or without masks, etc., etc. And my response remains that there's people much smarter than I who came up with these models, and they haven't really panned out the way it was expected. In a positive way, we have been doing much better than what's expected. These are the models from beginning of February, so 4 weeks ago now. We would be expecting to have seen an increase in hospital admissions already, while we continue to decline at the provincial level. So certainly good news, but as I mentioned, that decline is certainly slowing down at this point of time. Next slide. And similar with ICUs, much lower than expected. You see that big gray area, which was considered as the range of plausible scenarios. But despite all the opening steps, it continues to decline. But as I mentioned this week, it looks like we might be starting to plateau. Next slide. The local modeling here, again, I cannot show you the latest one. I can only show them once they had been presented to the Board of Health locally. But what we basically see is that that swell that was expected to happen mid to end of February, so these are hospital admissions, that swell will likely still occur, but has been pushed out. And the good news is we will be starting that swell from a much lower baseline than what we would have expected in this model, where we would have expected the swell to start early February already. I would say locally, when you're looking at number of hospital admissions of Hamiltonians or ICU admissions, it's quite stable for 4 weeks now. So it hasn't been declining any further, but certainly not increasing either. It's just been around those roughly 1 to 2 admissions of Hamiltonians per day at this point of time. I think that's all I had to share today. Back to you, Aaron.
Okay, thank you very much, Dr. Mertz. Next up, Dr. Barry Lum, who is going to give us an update on the progress we are all making together on Project Odyssey. Barry, over to you.
Thanks, Aaron. Hi again, everybody. So a little brief update again today, and I'm sure you're now very familiar with our roadmap slide that describes our journey and how we're creeping closer and closer to the go live phase of this project. Next slide, please. So as of today, we are only 85 days away from our go live. The activity level, of course, is accelerating, and there's lots and lots to be done. But I have to say I'm incredibly proud of the the Odyssey and Epic team, but I also incredibly grateful for the amount of work that's happening on the operational side of the organization and how people have dug in. Next slide. A good example of this is something called high impact workflows, or yet another acronym that we're calling HIWF. These are areas where if they were not adequately addressed, could trip us up when it comes time for go live. So they need our attention now to be able to identify the areas where previous organizations have found that there are very important items that need to be done so that we won't be in a position where we're unable to deliver prompt and safe care. So there's a lot of work happening on this. And we started this work quite some time ago, but we began to engage our operations side of the house, our managers, our leaders, our physicians, a few weeks ago, almost a month ago now. And the work that has been accomplished to date is really nothing short of fantastic. We had presentations about high impact workflows last week at the Go Live Readiness Assessment, and we continue to look at those. So it really has been incredibly gratifying to see the work being done. You will start to hear leaders, especially on how we intend to exploit and utilize the CQI tools that the organization has already developed and to use those to help move the high impact workflow process along. So you'll be hearing more about this. If you want to take a few minutes and see some of this work, I would encourage you to go to the hub. They have, Carissa and others have started to develop the site that has all of the high impact workflows on it and how that will, the work that's been done and how we'll move it forward. And you'll start to hear about a variety of tools that we're going to bring to bear to help you get comfortable for these high impact items as we get closer to and as we go live. Next slide, please. So on training, I'm really glad to again be able to congratulate the organization. We're at 80% in terms of registration. We're getting very close, as all of you are probably aware, to the sort of final deadline of March the 18th, where we need to get essentially everybody who needs to be trained up and in the system and ready to go. As we move towards the next phase of this, you will start to hear us emphasizing the e-learning piece, and I'll get to that when I get to the next slide. If there are any individuals who say, or managers, directors who say, listen, we're still missing classes, we haven't been able to find where we need to go, there is still an opportunity to make the changes add classes if need be. And at the bottom of this slide, if you don't know them already, there are the email sites that can help you with that. We are absolutely aware that there was some lag in our ability to respond, but the team has now gotten close to the bottom of the list and should be able to respond to you in a timely manner. Next slide, please. So as we do that, it's really important that as we complete the registration, we absolutely encourage the next phase of this, which is the e-learning. So everybody who has to go to the classroom, and we all do, needs to, before that, take the time to do these e-learning modules, which are short vignettes in the 3 to sort of 5 or maybe 7 minute length, where you sign on to the LMS, complete the item, and then it will get a little check mark, and we'll get all of those items put to bed prior to showing up for your in-class training. So these are important. They need to be done and completed before you go to the classroom. And so please take the opportunity to start to look at those. You can do a couple at a time, and I don't think you're going to find them onerous. And in fact, I think you'll find them really quite informative about what's coming. Next slide, please. So just a brief overview one last time. On the yellow chevron, you'll see e-learning, which is what I was talking about on the previous slide. Once that's completed, you'll go to the classroom. After that, you'll have a little quiz, and we'll make sure that you've got your login credentials all sorted out. And of course, then we will go live. But your training and your experience doesn't end when we go live. We will have tip sheets and all kinds of other resources available to you to reference, not just as you prepare to go live, but once you are live and as we go forward in the stabilization phase of the project. And last slide. So what's coming? Many of you will have seen the technical dress rehearsal folks on the wards. I saw them this morning at the Juravinsky, and I think they're moving around. These are incredibly important items to make sure that all of the devices in the organization can talk back and forth to the Epic system. So that's ongoing. Our super users begin their formal training on March 21st, which is very exciting. Like now we're getting there. We're starting physically, actually putting people in classrooms and starting the training. And of course, you'll hear more about something called the ARCR Summit. In April, in-class training begins for the rest. We'll be having our 60-day go-live readiness assessment for those folks who are on that distribution list. You'll hear more about something called patient flow days, which is for staff and physicians, and then an operational readiness day towards the end of the month, which will help you understand what's going to really happen when we go live. So lots and lots going on. Don't be shy, please, to reach out to us. We say it over and over again, and you can do that through the contact at the bottom, odyssey@hhsc.ca, or just reach out to any of us in the project directly. Thanks, Aaron.
All right, good stuff. Thank you very much, Barry, for that update today on Odyssey. Looming closer every day. So as Rob said off the top, this week we all celebrated International Women's Day. To talk to us a little bit more about what we've been doing at HHS is Shannon Kitchings, who's a human rights and inclusion specialist at the organization. Shannon, what do we need to know?
Thank you. So yes, as Rob mentioned, March 8th was International Women's Day. And like all days of significance, weeks, months of significance, like Black History Month or Pride Week, you have an opportunity to continue to celebrate, learn more, and honor one another throughout the year. And so if you haven't already, we really encourage you to visit HHS Share to read the International Women's Day 2022 story. It's fantastic, and really a sincere thank you to the women at HHS who shared their experiences to create such a great story. And I really hope you check it out. If you visit the website to our new Employee and Family Assistance Program, Homewood Health, you will find many resources to support International Women's Day. They are there for a little while longer as well, so check it out. There's a really great article entitled Women's Mental Health, and we encourage you to take a look at that article and some of the other resources on the Homewood site. The center, the Canadian Centre for Diversity and Inclusion, has created a really great collection of educational resources, and they include books to read, films and television shows to watch, TED Talks to learn more. And you can find this resource via Google, or you can check it out on the Human Rights and Inclusion Team Event Hub page. If you visit the Hamilton Chamber of Commerce website, under special initiatives, you'll find a report called Women Out of Work, Assessing Hamilton's Employment Disparities During COVID-19. This report is incredibly informative. It's absolutely worth reading and includes sector-specific analysis for healthcare in Hamilton. So we highly recommend that as well. And finally, at HHS on March 8th, we collaborated with Dr. Smita Halder to launch the first Women's Physician Affinity Group. This group is open to all women physicians, and trans women are women too. So all women across HHS, if you were unable to attend the first meeting, but would like to attend in the future, or would just like to learn more, please feel free to contact Dr. Halder, or you can reach us at Human Rights and Inclusion Team at inclusion@hhsc.ca. Thank you so much. Back to you, Aaron.
Amazing. Thanks very much, Shannon, for bringing all that together for everyone's awareness. That's good. So as I said off the top, if you have any questions about any of the topics that you heard today, you can always email those questions to hhsnews@hhsc.ca. You will get an answer very promptly through that forum, so please do, and always happy to have suggestions about topics or concerns that could be addressed at our future town halls. Now we have the opportunity to conclude our agenda with some celebrations. If you have a celebration you'd like to make, you can raise your hand in the participants forum, and we'll call on you to give your celebration live. Our panelists can also raise their hand and give a shout out should they wish, or you can type it in the chat function, and I'd be happy to read out your celebration for everybody's benefit today. These could be things that you've seen in the organizations, maybe some support you've experienced, or a remarkable accomplishment of a colleague or a team, some good news that you've seen and see fit to share with everyone. So we have one here from Naham Azam. Shout out to Sarah Anderson, our inaugural Social Work Excellence in Practice Award winner. Way to go, Sarah. So our inaugural Social Work Excellence in Practice Award winner. From Caroline Krapels, it's Social Work Week. Thanks to all social workers for their contributions to our patients and our teams. Awesome. Thanks for pointing that out. Again, another happy Social Work Week to all. So a theme there for sure. Happy Social Work Week to all of our social workers. Also here, so we have something from Jason Thomas. Hello. Just a note that March is Pharmacy Awareness Week, an opportunity to acknowledge our hardworking pharmacy team. So awesome that March also holds a Pharmacy Awareness Week. So we'll make sure to make note of that. From Stephanie Furtado, Happy Child Life Month, another wonderful celebration. So happy Child Life Month. Thanks for pointing that out, Stephanie. And from Sarah, congrats to all the credentialed trainers who completed their panel presentations yesterday. Another step forward to go live. So in reference to Project Odyssey, building on Dr. Lum's update already. So thank you for pointing that out. And Jason's just reminding us, should have mentioned that it's Pharmacy Awareness Month, not week. I thought as I was reading that, I thought maybe it's the week within the month, but no, it's the month. So thanks for pointing that out, and happy Pharmacy Awareness Month to all of our pharmacists. Okay, here we have something from Kirsten. Happy Dietitians and Dietetic Assistance Month too. March is clearly a month of celebration as people emerge from winter and we want to celebrate. So happy Dietitians and Dietetic Assistance Month as well. Great stuff. Let's just see here. I have one attendee with a hand raised, Monica B. Monica, we'll go to you now if you'd like to make your celebration. You'll just have to unmute on your end and you should be able to make that celebration. So please go ahead.
Sorry, that was a mistake, lowering my hand.
Well, we celebrate you for acknowledging that mistake live. Thank you. Okay, other shout outs here we have from Leslie Gillies. Thank you to the JHCC Juravinski Hospital Cancer Center M2 and M3 rehabilitation teams who are returning this week to respective units as rehab beds increase back to regular numbers. Thank you for your flexibility and responsiveness during this most recent Omicron wave. For sure, an important thing to mention for all those that are moving back to their home units and have been deployed to support COVID care. Thank you very much for all of the hard work, the flexibility, and all that you've done. Great point. Thanks, Leslie. I see Bernice Garland with a hand up. Bernice, if you raised your hand to make a celebration, you can go ahead. You just have to mute on your end. Unmute. Or maybe you've raised your hand in error too. From Michelle Leaflor, thank you to the team deploying and now testing thousands of hardware items for Project Odyssey, a major undertaking. So Bernice, one more time to you. Maybe not. Okay. Well, I'm going to suggest that we leave it there. We'll have a couple of celebrations probably still coming in. Maybe last one here, Rob, from Stephanie Furtado. Congratulations to the Master Children's Hospital team as we have launched our new PEDS pressure injury risk assessment tool and prevention care plan. So there we go. And I'll leave it with you, Rob, for final words. Thanks, everyone.
Thanks, Aaron. Thanks to all of our presenters today, who I thought did a great job. And as always, thanks to everybody for checking in on the town hall today. Over 300 folks today took the time to stop by. Hope everybody has a great rest of the day and a great rest of the week. Thank you all for all that you're doing. We're very grateful for it. So cheers, everybody, and we'll see you next time.